Did you know that eating disorders affect over 70 million people worldwide? Yet most cases go undiagnosed due to stigma, misinformation, or cultural misunderstandings. These are not just dieting gone too far. They are serious mental health conditions that can affect anyone, anywhere. So, what's the truth about eating disorders? And how can we help those who struggle? That's what we will be discussing today. Eating disorders are not just about food or weight. They are mental health disorders influenced by psychological, genetic, and environmental factors. They affect people of all ages, genders, and cultures. But despite their severity, eating disorders are misunderstood and often dismissed. Many people suffer in silence because they fear judgment or don't realize they have a problem. Today, we'll talk about the truth behind eating disorders. What causes them? How they impact people worldwide? How we can support those struggling, effective treatment options and recovery paths. Before we continue, let's first clear up some myths and misconceptions. Myth number 1. Only teenage girls have eating disorders. The truth is, eating disorders affect people of all genders. 1 in 3 cases occur in men, who often go undiagnosed. Myth number 2. It's just about wanting to be thin. The truth is that some eating disorders, like binge eating disorder, BED, are more about emotional distress than body image. Others involve an obsessive need for control. Myth number 3. It only happens in Western countries. The truth, eating disorders exist worldwide, but cultural perceptions vary. In some places, they go unrecognized due to different beauty standards or lack of awareness. Myth number 4. You can tell if someone has an eating disorder by their weight. The truth. Many people with eating disorders appear healthy but suffer severe mental and physical health issues. What are the types of eating disorders? First, there's anorexia nervosa, or simply anorexia. This is when someone is extremely afraid of gaining weight and eats very little, even if their body is already underweight. This manifests as constantly skipping meals, counting every calorie, and exercising excessively. Even when the body is weak and undernourished, the person still believes they need to lose weight. Next is bulimia nervosa, or bulimia. This involves eating a large amount of food in a short time, also called binge eating, and then trying to get rid of it by vomiting, taking laxatives, or over-exercising. This can look like secretly eating a lot of food in one sitting, followed by guilt and an urgent need to undo it by purging or excessive workouts. Then, there's binge eating disorder. This is similar to bulimia, but without purging. A person eats large amounts of food, even when they're not hungry, often feeling guilty or out of control afterward. This can show up as eating rapidly, continuing to eat even when full, and feeling ashamed or upset afterward, but not taking steps to remove the food from the body. Lastly, there's avoidant restrictive food intake disorder, or ARFID. This is when someone avoids certain foods, not because of weight concerns, but due to sensory issues, past trauma, or fear of choking. This may appear as someone eating only a very limited range of foods, feeling extreme fear when trying something new, or avoiding food textures that make them uncomfortable. So you might want to ask, what causes eating disorders? The simplest answer is there is no single cause. It's a mix of biological, psychological, and environmental factors. With biological factors, genetics. Studies suggest that up to 50 to 80% of the risk is inherited. Brain differences. Research shows people with eating disorders process hunger, reward, and impulse control differently, with the psychological factors. Many people with eating disorders also struggle with anxiety, depression, or OCD. They often use food control as a coping mechanism for emotional distress. Environmental and social factors. Social media and beauty standards. Studies show that excessive social media use is linked to higher body dissatisfaction and disordered eating. Cultural expectations. Some cultures emphasize thinness, muscularity, or clean eating, which can lead to unhealthy behaviors. Trauma and family pressure. Childhood trauma, bullying, or unrealistic expectations about food and weight can trigger disorders. For example, I remember a friend once telling me that when she was 14, she started skipping meals. It felt like the only thing she could control. At first it seemed harmless, but soon it controlled her. She thought she wasn't sick enough to ask for help because, in her words, I didn't look underweight. But eating disorders don't have a look. They're mental illnesses. Stories like this from my friend highlight that eating disorders are serious but treatable. The key is awareness, early intervention, and support. How to support someone with an eating disorder. If someone you care about is struggling, here's what you can do. 1. Learn and listen. Educate yourself on eating disorders to understand what they're going through. Listen without judgment. Avoid comments about weight, food, or appearance. 2. Encourage professional help. Eating disorders require specialized treatment. Gently suggest talking to a doctor, therapist, or support group. In many countries, there are free helplines and resources. 3. Avoid harmful comments like, "Just eat more." It's not that simple. You don't look sick. Eating disorders aren't always visible. "I wish I had your willpower." This can reinforce unhealthy behaviors. 4. Another important thing to do is to offer emotional support. Be patient. Recovery takes time. Remind them you are there for them and help is available. Treatment and recovery options. Eating disorders are treatable, and full recovery is possible with the right support. Treatment options include cognitive behavioral therapy, or CBT, is one of the most effective treatments. Medical support. Some cases require medical supervision to restore physical health. Nutrition counseling. Working with dietitians helps rebuild healthy eating habits. Support groups. Talking to others who understand can be life-changing. Medication. In some cases, antidepressants or anxiety medication may help. The key to recovery? Early intervention and a strong support system. Eating disorders affect millions worldwide. They are serious mental illnesses, not choices. They don't discriminate by age, gender, or culture. Support and treatment can save lives. If you or someone you know is struggling, help is out there. Drop a comment. What surprised you the most about eating disorders? Share this video. You never know who might need this information. Be sure to check my other videos. See you next time.